Hi, I'm Dr. Colleen Guilfoyle. I am a staff veterinarian at Best Friends Animal Society, and I will be discussing canine behavior in animal shelters. In this presentation, I'd like to consider behavior from a holistic approach. As we see on the slide, behavior reflects physical, emotional, and mental state. I want to take a quick minute to review the 5 domains of animal welfare and how they intertwine with animal behavior. So the first 4 domains, nutrition, environment, physical health, and behavior, focus on specific experiences, negative or positive, that contribute to the mental state, domain 5. The first 3 domains, nutrition, environment, and physical health, have the potential to disturb internal stability, resulting in sensory inputs associated with behaviors. The behaviors are intended to restore internal stability. So domain 4, or the behavior domain, I think of as the ability to cope with the first 3 domains. When we're thinking about each of these domains individually, nutrition indicates a diet that's suitable for age, breed, and health status, and can also be seen as an opportunity for enrichment. Animals should always have access to clean and fresh water. Environment should be safe, comfortable, and stimulating. Adequate space and freedom of choice are essential. Things to think about in this domain are noise, smell, temperature, and the presence of other animals. Physical health includes prevention and treating illness and injury. I think prevention is really important, so that's when we're thinking about keeping our animals up to date on vaccines and also preventing both physical illness and behavioral challenges from progressing. Behavioral interaction can include play, socializing, and exploring. Here we also like to reflect on the choice and control of the animal. And like I said, I often think of this domain as the ability of that animal to adapt to things that are happening in the first 3 domains. The mental domain or mental state, here we want to think about protecting animals from fear and distress, providing love, care, understanding, and companionship. This diagram I think is fantastic. It's from the book Animal Behavior for Shelter Veterinarians and Staff. It depicts how genetics, the environment, and medical conditions and disease processes all contribute to behavior. The relationship and interconnectedness of all of these components will be reflected in the overall health and welfare of the individual. And so much like we talked about in earlier slides, thinking about behavior as a piece of overall health and welfare in the holistic view of the animal and their behaviors. It's important to consider how medical conditions can result in behavioral changes. All medical conditions will result in some behavioral change. There are super simple explanations for this when we're looking at physical illnesses that cause anorexia and lethargy, and more complex explanations, such as every behavior is the result of a neurochemical action in the nervous system, and therefore it can't be separated from the physiological state of the animal. Some behavioral changes are associated with organic disease, and what this means is space-occupying masses in the central nervous system, and also infections and inflammation that can occur within the central nervous system. There's also lots of unknown about what actually occurs when there's dysregulation at the neurophysiological or neurochemical level. This is an area of active research both in human and veterinary medicine, and so it's an area that we know is important, but we are still understanding how these things interplay. The importance of reducing stress in the shelter setting can't be stated enough. So for most dogs, the shelter is a loss of space, freedom, social interaction, and the creature comforts of a previous home. This part doesn't apply to all dogs, especially when we're talking about dogs that may come from potential neglect or hoarding. But one thing we know is true for all dogs, the shelter is a major change from what they know. There are different types of stress when we're referring to animal behavior. So there's the normal stress that an animal might endure when they're dealing with day-to-day life. And then there is extreme acute stress, so stress beyond what an animal is able to cope with. And then there's chronic low levels of stress. So the last two examples, extreme acute stress and chronic low level stress, can be referred to as toxic stress. And when we're talking about this type of stress, this is what can result in a lowered ability to cope. It can impair social behavior and increase fear. So when I refer to stress on this slide, what it's referring to is that toxic level of stress. So chronic stress is linked to aggression, anxiety, and depression in many species, and social and spatial restriction has been associated with the increased displays of aggression. What a stressful or painful animal looks like is different for different individuals, but I wanted to touch on some of the common displays of stress in our shelter animals, and this helps us address these problems sooner. So stress in some individuals can look like trembling, crouching, snout licking, smacking of their lips, yawning, restlessness, paw lifting, repetitive behaviors, or eating their or other conspecific species. Pain can be very different amongst individuals as well, but it can look like anorexia, aggression, hunched body posture, reluctance to move, or once again, restlessness, tense facial muscles, changed vital signs, rubbing, and avoidance. Who is most likely to stay in your shelter the longest? I think this is a great slide to begin thinking about and talking about identifying dogs that we know are going to stay in our shelter a long time. For different geographic regions, what this dog looks like can be different, but as many of us experience, these dogs often look like the dogs we see here on this slide. So we actually have some data that shows us who is staying longest in shelters. So this study comes from Austria, but I think that many of us will agree that the data is probably similar here in the United States. And so this paper looked at morphological and behavior characteristics that can be used to identify individuals at higher risk of a long-term stay. And these were older dogs, they were male, they're of large size, and often they were bully breeds. And so they weren't extremely specific about what this meant, but I think it can be looked at as pit bull type dogs. And so by being able to identify these dogs as soon as they walk into our shelter, we can make plans for them that make sense and get them out of the shelter as quickly as possible. The next paper I wanted to talk about was this paper about behavior evaluations. And so behavior evaluations can be a bit of a hot topic because most of the time they're very well intentioned, but as the title of this paper says, no better than flipping a coin, reconsidering canine behavior evaluations. So what this paper concluded was that even if these tests yielded good sensitivity and specificity, the predictive value of behavior evaluations would still be about 50%. And with the tests we currently have, which have poor sensitivity and specificity, the predictive value of these tests is around 12%, meaning that 88% of positives will be false positives. And so our stance is to do away with these formal behavior evaluations and instead interact with dogs in normal ways that reflect how you would in the home, and keep detailed objective notes on what these behaviors look like, and use that information to guide decisions and adopters. Behavior evaluations can be seen as trying to bring out the worst in dogs, and instead of that, we want to maximize opportunities to interact in normal ways that mirror what they are expected to do once adopted. This can look like walking on leash, socializing with people, play groups with other dogs, games, and training. Ideas for interventions in the shelter are enrichment, which can include human socialization, canine social interaction, object enrichment, and sensory stimulation. A research finding that I really loved that was that 15 minutes with a person, even if it was a stranger, in a shelter dog's kennel could decrease the dog's heart rate, increase the dog's heart rate variability, and reduce standing by the dog during the interaction. So when we're looking at these indicators of potential stress, you can see that even 15 minutes with a stranger can have a huge impact on their physiology. Another intervention is behavior modification. And I would encourage behavior modification to look like part of their daily routine. Training per se can be very difficult for dogs that are in this high stress environment, but things like weight and 4 on the floor are all reasonable things for your staff and volunteers to work with every dog with every day. The third is play. In recent years, we've learned how important play is for dogs' well-being, and it can really be an opportunity to showcase their spirit to adopters. Adopters really love to see dogs playing together. It's a big reason people love dogs, and so I think highlighting dog play groups can be really helpful and effective and also have a positive impact on the dog. Psychopharmacology on animal behavior in animal shelters can be quite simple or quite complex. This is a common place for shelter veterinarians to get called in when we are looking to reduce the amount of stress that animals are feeling in their kennels. So usefulness in the shelter is that you can address immediate welfare concerns, improve adoptability, and facilitate transitions, whether that is into the shelter or into the home. Limitations are that psychopharmacology does not change behavior, only the emotional state. So a common example I give for this is the dog that's jumping vertical in their kennel. And there's a request to increase the medication, increase the medication, increase the medication. They want them to stop jumping in their kennel. And the reality is the medication isn't going to change that behavior. All it's going to do is potentially make that dog more calm internally, increase serotonin, and potentially be able to focus better during a training session. But the medication itself does not change behaviors, especially learned and ingrained behaviors. Another thing to consider is length of stay when choosing medication. So if your average length of stay for a dog is a week, then there's only a few medications that are going to be helpful during that time period. So things like fluoxetine that take quite a bit to build up in the dog's system are not as effective in those shorter length of stay patients. And it's just something to always consider when you're choosing behavior medications. There are some behavior medications that can cause learning impairment. Clonidine is a commonly mentioned one, and so if you have training goals for this particular patient, you will just have to keep in mind that we do know that some of these drugs can impact their ability to learn and remember things they're taught. As a veterinarian is working towards coming up with a behavioral diagnosis, there are a few things we need to consider. First is the trigger. So this is the event or environment that incited the behavior of interest. Next is the intensity. And so this looks at was the reaction proportionate to what happened, proportionate to the trigger. And finally, persistence. So persistence looks at how long it took for this particular animal to recover from this particular event. And when we look at all three of these things combined, we can identify a diagnosis, whether that is separation anxiety or hyperarousal, and then we can choose an appropriate medication for that diagnosis. Here are some common behavior medications we use in shelter dogs. So as we see here, we have our daily, long-term, several weeks to take effect medications like fluoxetine and Clomicalm can be helpful, but we once again have to remember our length of stay and what we're going to do for those dogs in the meantime. Situational adjunct or secondary medications can be used short-term. They can be used just when they're needed, and these are benzodiazepines, alpha-2s, trazodone, and gabapentin. And this group of drugs tends to be much more common in the shelter world, especially if you have dogs that have shorter lengths of stay. I just wanted to come back to this figure one more time. I think it does a great job at depicting how genetics, environment, and disease processes can all contribute to different aspects of an animal's behavior, and how all four of these together contribute to the overall health and welfare of the animals in our care. And so I think as healthcare professionals and animal advocates, we have to think about all of these different factors when we are talking about behavior, not necessarily just behavioral modification and psychopharmacology, but also thinking about other factors like the environment and the genetics of that particular animal. I wanted to share with you guys a few of my favorite sources when referencing animal behavior. So aside from primary literature, I think that this animal behavior for shelter veterinarians and staff is really phenomenal, and for a broader view and non-shelter specific physiology of behavior, and also when I'm looking up indications for medication and dosing, I like the Manual of Clinical Behavioral Medicine. Here are a few additional references I used that were primary literature. A few are the articles referenced early in the presentation, and then a few additional ones. And finally, I just wanted to say thank you. Thank you for listening to my presentation, but more importantly, thank you for being interested in animal behavior to better advocate for the dogs in your shelters. And so thanks for listening.